All right. Assalamu alaikum, everyone. Good afternoon and good morning. I'd like to thank you so much for being here and welcome you to the session 2 of the Jazeera Rural Primary Care ECHO program. My name is Fatima Abu Zaid. I'm a graduate from the University of Jazeera, and I am currently a UNMC research assistant, and I will be facilitating today's session. We will be going over the general outlines for the session today. We'll have a small welcome and introductions, and I believe we already started that. So if you are just joining in, please introduce yourself in the chat. We'd love to know all of you guys. We'll be going over some session reminders, and then we will move on to the first part of the session, which will be the didactic presentation. And our subject matter expert and guest for the day is Dr. Mohammed Nour. He'll be giving us a session about health promotion and risk reduction. The second part of the session will be the case-based discussion presented by Ahmed Khalid. And last but not least, hopefully, we will have some time for general Q&A. Going over some housekeeping reminders. This is a reminder that discussion always makes this work best. So, I mean, this is what you guys are here for and what we are here for. We'd like to hear your opinions. So please feel free to type them in the chat any minute or just raise your hand and we will give you a chance to open your microphone and speak. Unless that, we'll kindly ask you to please stay muted. We also love to see your faces. So if possible, please leave your cameras open. And a reminder that the sessions are recorded and will be available by the end of the presentation on the iEcho platform. And if you guys are joining from the hub, please make sure to log into iEcho to mark your attendance so you could be guaranteed a certificate by the end of this. I'd also like to thank all the participants in today's sessions. I'd like to specifically thank the University of Jazeera Faculty of Medicine students, the faculty, University of Nebraska Medical Center, our global ECHO team, and the ECHO India team, and our beloved guests. We will be starting our first part of the session today with Dr. Mohammed Nour, who is a consultant in community medicine at Health Protection and Communicable Health Disease in the Disease Control Department in Qatar. And I also like to remind you that you will see these flyers around in uni, so just feel free to scan the barcode and it will take you directly to the iEcho website. We can start today's session with Dr. Mohammed Nour. If you'd like to introduce yourself, and the floor is yours.
Well, thank you very much, Dr. Fatma Abu Zaid, and thank you, Dr. Mujtaba Abdulatif. Thank you for ECHO team for giving me this chance to speak and share with you and the esteemed guests and the students some talk about the health promotion and reduction of risk. In fact, let me start by thanking, the team or the persons who did select this very unique topic, which is joining to very smart aspects about health, which is health promotion and risk reduction, because the ultimate goal of the health promotion is to reduce the risk and to empower individuals, communities, and countries and the entire globe so that they are having better health and health outcomes and live better lives. So with that, I would like to share with you the screen, or you are sharing already. So if you can move.
You want to share yours? No problem.
Yeah, because that will give me control over the slides.
Yeah. All right, perfect, no problem.
Right, thank you very much. I will share it now. I hope now you can see the share the screen and that I have just put in the slideshow. Right. So I will start by highlighting the the health promotion in the essence. So we are going to discuss in the essence what the health promotion and from where it has come from. And I would tend to believe that the health promotion is a kind of the natural evolvement of our, understanding of our lives, the health and the environment around us, and how the dynamics between all the elements of life will tend to produce the outcomes of health that affect everybody of us. Not only us, it also affects the nature around us, the environment, the climate, and the animals, and the microbes, and everything. So it has really been a kind of remarkable shift from, the focus on the individual to everybody around the individual, including the groups and the species which share with us the lives. So what are the foundations that we know about the health promotion? I believe the remarkable foundation for that is the Almaty Declaration, which is in Kazakhstan. That happened in 1978 in Kazakhstan. At that time, it was part of the Soviet Union, and now it is Kazakhstan, and even they changed the name of the city. However, they have come to realize that this is a time to advocate to have health for everybody, health for all, and by that they have advocated to have ensured equity to access the service, and also to control the determinants that we are going to discuss in seconds, the determinants of health, like the poverty, which also contributes to the access of the healthcare systems and healthcare facilities and services, and the health as a fundamental human right. So everybody got to access the health regardless of his background, the ethnicity, the cultural beliefs, and the political kind of color. These are all not to be, counted as, one wants to access health or to gain health situation, and also to use the appropriate technology and to ensure that in order to produce health, multiple sectors and multiple disciplines have to come together in order to achieve the health. For now, you are going to see this kind of very broad terms, but when I come to the examples, it will be, shown how these will come together. In all this Almaty Declaration, I can tell that it is the first international conference where the primary health care was underscored, was emphasized for its role, regardless of the elements of this PHC, whether being 8, 10, 13. However, it is the very first kind of conference to bring the countries and states and governments and communities together in order to understand, each body's role and advocate for health. And it started for the developing countries, the poor ones, whether low or middle income countries. But after only 5 years, even the developed countries found it useful for them to apply the same concepts of the primary healthcare of Almaty. And I would like to stop a minute in the community participation that has been called by Almaty Declaration as one of the cardinal aspects to be considered in Almaty Declaration for the primary healthcare, because without the effective participation, and please underscore the word effective participation of the communities in their health, no initiative, no program, no plan is going to work, because everything starts in the community and ends in the community. It is the choice of the community. It is the ones who are going to pay for health or for disease. It is them who are going to accept to take vaccines or to reject to take a vaccine, to respond to recommendations issued by the responding authorities like the governments or the agencies, or just to abandon them, as we are going to see. And the second most remarkable turn for the positive direction in attaining the health collectively was the Ottawa Charter that happened in a conference has taken place in Ottawa in Canada in 1986. So in less than a decade, the people have realized that only declaration is not going to help. What we need analysis for each situation using these 5 principles of Ottawa Declaration, which is starting from the individual, giving him the skills that he needs in order to attain control. So the overall definition of the health promotion that has come out from the Ottawa Charter and Conference is that we needed to ensure that through a process, which means that it is a kind of dynamic action process, starting by analyzing the problem so that we can strengthen the individuals and giving them more control over their health. That means we have to have a dialogue with the individuals so that they can understand their options and the consequences for each option they would take for themselves and for the people that they take care of. And with that also, we move on from the individuals to the communities, from the communities to the states and governments and agencies. So for each kind of problem, there is a role for the individual, and there is a role for the groups around the individual, being families, being a group in joined by a kind of concern toward a particular problem, for example, Cancer Society, or a group that's anti any kind of governmental issue that's going to ultimately affect health, or a group who are advocate for having a healthy and friendly environment. So a group of people, and reorientation of service and creation of environment that is supportive to the public health choice or the healthy choice. And that's all to be circumvented by a public health policy, laws, regulations that is going to support all the above mentioned concepts. And that will revolve around 3 main aspects, which is enable or empower, mediate, and advocate. So this is the outcome of the Ottawa Health Promotion Charter and Conference. So, but how can we understand the role of everybody and how the policy will affect, and how we can identify the risk factors, whether being environmental or societal or economic, to produce a certain health outcome. And here comes the role of the epidemiology, which in the very basic definition of it is the study of the distribution and determinants of health related states or events in a specified population, and the application of this study to the control of health problems. I hope from this definition, and please stop me at any moment if you want, and I'm going also to ask you as we go forward in this presentation for some questions so that we can have an interactive session here. So through the distribution of determinants of health. So the determinants of health, these are in simplified terms, the factors that would contribute together, or if you wish to name them as variables, independent variables that will be associating a kind of problem or leading to a certain outcome. For example, if you take the cancer of the colon as example, you will have different factors contributing to that, including the age, including the diet, including the personal kind of genetic fabric, including the physical activity, including the type of nutrition that everybody is having, including also the other habits that are involved. So this is just to give one of the examples of the determinants or the variables that can lead to a particular outcome. And I would like to go back to Al-Ma'ata Declaration, which has redefined the what we know now is the definition of health. Because before Al-Ma'ata Declaration, health was defined as only a state of being free of the disease. But after Al-Ma'ata, now we know it is a kind of a state where not only being free of disease can define you as a healthy person, but to have a state where you have integrity of physical, mental, spiritual, and societal kind of integrity. So if somebody is healthy physically, but he's having a mental problem, we cannot call him a healthy person. If somebody is isolated and do not have the skills or is not enjoying the social normal life, then we cannot tell that this person is healthy. And we have seen why that kind of definition is important, because without that kind of definition, very serious problems are expected to happen. Conflicts that are leading to displacing persons from places to other places are cause of that. And having kind of inequity, you have seen now the different societal problems happening in different parts of the globe. You know now Black Lives Matters in America. You know the conflicts and the conflict that has happened in Sudan since the last century in 1955, and that led to the split of Sudan to two countries, South Sudan and Sudan, was part of that kind of unhealthy situation of the communities sitting together. So all the wars, if you wish, most of the problems that we are having in our planet, if you analyze them in a very good and neutral way, you will end up with determinants of health that we are mentioning here. And again, this is the triad for the epidemiology. And again, this is helping into analyzing what roles that are needed to be taken by everybody. For the health outcome, you have elements related to the environment, to the agents that are causing the problems, being infectious disease or non-infectious disease, and the host, which is either us as humans or the host being animal or other vehicle for the health problem. And this is another kind of thorough look into the triad of the epidemiology, which is there are factors related to the agents. For example, now we see rising problem in the antimicrobial resistance. So the weapons that the humans are having in terms of antibiotics that were produced in the last century, in the 40s of the last century onwards, now we are losing these weapons, and the microbes are developing itself in a better race compared to the human capability of pacing with them and generating new antibiotics. So the environment is also contributing to that. You can name so many problems. I'm not going to go deep in the infectious disease, despite these are my specialty. But let's, for example, see about the mental health problems that are happening. The environment, if you are working in a kind of hostile environment, or you are studying in an unhealthy place where the people are not having a kind of friendly relationship with each other, then you would likely have an outcome of isolated persons or stigmatized persons, or persons who might develop certain psychological problems down the road of their lives. And that's explaining why we need to look into each of the problems using the principles of Ottawa Charter and triad of epidemiology and the epidemiology study of determinants of health. So what are the risks that shape our world today? Anybody who would want to contribute by telling some of these risks? What are the risks that you believe shaping our current world today? Why we are having this, kind of risk? We are having so many disasters happening here and there. Any volunteer?
I believe that one of them is the lack of health knowledge in most of the population around the world today.
Right. So this is one, because if you have the knowledge, you are likely to take the decision. But based on these health promotion principles, do you believe knowledge alone is sufficient to propel people to take the right action? How many people knowing that since the release of the General Surgeon report in 1964 about tobacco and smoking, and that it leads to serious problems, including cancer. Since that time, the people knowing that evidence tells that the tobacco consumption, regardless of type, is associated with cancer and serious cardiovascular diseases. So everybody knows. Was that sufficient to help the people take the right decision?
We have some answers in the chat, Dr. Mohammed.
Yeah, if you can help read them through.
Okay, all right. So we have Rishma Java said a population displacement.
Yes.
Iman Majdi said climate change, I think.
Yes.
Tajis Silshoki said industry. We have Farha said capitalism and climate change.
Yes, yes. And the human greed. Yes, yes. I like all these answers. They all in the right direction of shaping our world today. And let me here bring to you, as you can see now, we are traveling, more than ever before. Okay, now you have billions of people are moving from place to place, in a speed that's surpassing the incubation period of most of the pathogens that we know. Previously, the people tend to travel by ships over the sea, or using the camels, horses, donkeys, and this primitive means of transportation. And that will take them from days to weeks to months to reach from point to another. And that has holding or curbing the speed by which the pathogens can travel from place to place. But nowadays, it's just a matter of less than 1 day to have somebody who's having the disease traveling from one point to the end of the planet with the same disease. And also the climate change, as mentioned, and also the increased level of interaction between us and the environment and the animals. There is now more frequent interaction between us and these and the environment and the other species. You can tell it interface. The interface is having more active kind of dynamicity between all us in the biological kingdom, if you wish. And that's created more chance for the spillover of serious emerging diseases. You can name it. Any of the recently discovered emerging conditions like SARS, influenza, and with all its types, and also Ebola and monkeypox, and even COVID, they have all been produced because the viruses have for several and hundreds years of ages, managed to live peacefully with the wild animals and species. But when the man started to increase its active kind of dynamic interaction with them, and going inside the wild places and going up and also destroying the habitat of some of the creatures, and then we were attacked by the viruses and by the microbes living in these places, and also the different factors that lead to the displacement and mobilization and migration from place to another. Microbiological, antimicrobiological resistance or antimicrobial resistance that we have seen, and also the terrorism and the radiation activity that will all lead to a kind of natural or man-made disasters in terms of the floods, in terms of drought, in terms of the very weird and aggressive kind of looking for a better situation. So for the countries to improve their future chances for their nations, they tend to find or to put their hands on better resources happening to be in other nations that might be weaker, that might not be having the same kind of strength economically and military, and that will lead to others occupying or colonizing their territories in order to exploit the natural resources. So this is again one of the factors that shape our world today. As you can see, all these lead to health outcome. So the better understanding of why these are happening will help everybody take the right action. And now, for example, just to take an example for the climate change, there has been several conferences and high-level meetings with the great 20s who are controlling the economy of the earth, so that a real action can be taken to minimize the global warming by only 1 or 2 centigrades over the coming 2 or 3 decades until 2050, for instance. And that's bringing me to the point of vulnerability, because the vulnerability, in a very simple term, is to understand the characteristics that determine the susceptibility of an individual or community to an impact of hazard. Because without having these susceptibility and vulnerability concepts, you cannot empower yourself. So if we take in just a small example for me, if I'm going to a place where there is a certain disease is endemic, for example, if I am having a trip to Pakistan or Sudan, where malaria is an endemic disease, in order to increase my control over health, I might need to take a pill for antimicrobial drug, so that I'm aware of the risk. Also, I need to sleep under a mosquito net that's impregnated, so that I, in the first chance, don't get the mosquitoes to bite me and suck the blood and get me the plasmodium. So like that. So one of the important steps that were given for the health promotion is the study of the vulnerability and susceptibility. I don't want to dive into the risks and the hazards. However, the risk is that something bad is going to happen. And as I am talking to you doctors and medical students, it is one of the jobs that for us as doctors and clinicians to understand how the disease happens, so that we can identify who's at risk and who's not likely to get the disease or the health outcome. So in this, I would like to say that, for example, if you are taking the MERS-CoV, we know that MERS-CoV is being transmitted from the camels to the people who have frequent contact with these camels. It's a killing viral disease. It's one of the diseases that belong to the corona family. So it's named SARS, corona SARS-1. So here you can tell, if you go if you are above 50 or 60 of age, you are having cardiovascular disease, or you are having diabetes, renal problem, or you have any kind of situation where you have your immunity compromised, then you are at risk of developing or contracting the infection of the MERS-CoV. And also, if you contracted the infection, you are at risk of developing complications or even eventually end up dead because of the infection. So using the knowledge that we obtained by using the epidemiology and analyzing the outcome of the disease and making analysis of the reports that are happening, through the surveillance, using the epidemiology, of analyzing the data by time, person, and place, and the triad that I have mentioned, will get us clear idea about who's vulnerable and who's not, what is the risk, and what's the hazard. However, the hazard is something bad, but it's in place until other factors bring it to be a risk. It will stay like a hazard. For example, if you have electricity and you have a wire that's not covered, here is the hazard. But if you come close to it, you are bringing yourself to the risk of having electrical shock by that kind of stuff. So the risk and vulnerability assessment is good way to getting us to the point of understanding what everybody got to do, what are the contributing factors, and what are the policies, what are the environmental factors, and who are vulnerable to having that. For example, we have in Sudan, and this is happening also in Pakistan, we are having annually, we are having floods, we are having disasters happening. So the people who are living in the natural valleys, or are not listening to the advices of the civil defense to evacuate the places where it is likely, if any flood will come, they will be swept and washed away by the floods, then they are putting themselves at risk of of drowning or losing their livestock because of that. So it is a kind of very delicate process. Sometimes it's very natural that we do that. We do it habitually in all aspects of life. If you want to, for example, if you want to cross a street, you just turn left and right with your head to see if there is a car approaching, and if the speed of the car approaching is reasonable for you, will give you a time to cross the street, or you will be at risk of being impacted by the car if you dashed into the road. So we do this kind of risk. So this is the first step, using the science and knowledge, and then it comes the next step of assigning roles to everybody. These are small examples, but before I go there, let me ask you again, do you have any kind of example for a health promotion, for a problem that for which health promotion was used to help solve it or decrease its risk? I can also monitor the chat if you wish, or if you don't wish to use the chat, you can talk. Muttaba, if you wish, also with Dr. Fatma Abu Zaid, any one of you, to read through some of the interactions here.
Yes, Dr. Noor, we are monitoring the chat for any interactions, and we'll let you know. But in my opinion, we have someone in the chat, Mahab, saying asking to repeat the question before I give my opinion.
We need examples where the health promotion was used to control a problem, any problem that comes to your mind.
Yeah. Before we go into the chat, I have an example in mind, and very easily it is the COVID-19 pandemic, because health promotion was very important in battling the misconceptions that came out about the vaccines, about the virus itself, and everything that happened. It was a very hectic thing, but health promotion did play a huge role in downing or flattening the curve a little bit.
Yes, and in this COVID, you can say, after analyzing, we managed to see that it will spread if the coffee ticket was not produced. So for the individual level, you have to request the people to use the masks and to give them the skill of how to apply the mask in a good way that will decrease the risk of them spreading the germs or the viruses in the open air. Okay, and also to observe on themselves whether they appreciate symptoms of the disease or not, and how to approach the healthcare facilities in case they believe that they are at risk or they were in contact with somebody who turned to be positive case. Also for the groups to stay, and to practice the distancing. Again, for the individual is the hand wash. Okay, when it comes to the policy, is that the government is having a policy of allowing only those who are fully vaccinated to travel outside and the country and come back, and also to have a policy that's affecting or reorienting the service by establishing and designating facilities to be isolation facilities or quarantine facilities, and also staffing the treatment facilities with a skilled staff. So these are elements that we can use from the principles of Ottawa Charter of the health promotion for one problem that we faced and we have seen. Do you have any other kind of examples that we can tell? Yeah, I see here some good answers. Yeah, go ahead.
So in the chat here, we have Hanan Tahir. She said COVID-19 vaccination is an example of health promotion.
Yes, right.
We have Pervin said, for example, a breastfeeding campaign.
Yes, very great. Yeah.
And then we have Tajasir said heat exhaustion and a heat stroke. Health promotion is done by staying hydrated.
Yes, at least hydrated, and also having a policy and mobilizing laws of preventing the workers to work in the outdoor places during the heat portion of the day, like between 10, even 9:30 in some countries, until before the sunset, like in the afternoon when the sun starts its journey to set. Okay, what else?
We have Farha Bashir said hepatitis awareness campaign and vaccines.
Yes, hepatitis campaigns and awareness. These are great examples. Yeah.
And Lujane said breast cancer. That's actually a great, in October, breast cancer self-examination for early detection.
Yes, yes. If we can stop here for the breast cancer, self-examination is a kind of individual skill that we can nurture in the community so that they can detect early. What other aspects that you think about breast cancer can help? You have, and I will repeat the 5 principles of Ottawa Charter, which is individual skills, supporting groups, reorientation of service, creation of supportive environment, and building healthy policy, laws, and regulations.
Lujane says family screening.
Yeah, family screening, that's good. But for example, you can tell about the policy that every lady or every girl from age X until age X or age Z is to be annually or every 3 years screened for breast cancer if they they know that it is spreading in that population. Okay, so as you know now, the colonoscopy is being done mandatory in some of the countries for the people age 45, in some communities above that, annually, on an annual basis. Everybody who has surpassed the age of 45 or 50 is to undergo colonoscopy because they know that the early detection will increase the chances for cure. Okay, what else? This is a lovely discussion. Monkeypox awareness, campaign to raise people risk visit by Hanan, also here, and Lujane also. This is the point that was taken with Tabasana. In rural areas campaign example, anemia and awareness campaign. Yes, anemia awareness campaign, and how the people can prevent reaching to that end of developing anemia by the nutrition, by early discovery of the factors that can lead to the anemia and so on. That's good. So let's move on with the risk vulnerability assessment. Why it's not moving? Yeah. So this is example for one of the great successes of the health promotion, where we have seen decreased number in so many countries for the road traffic accidents or motor vehicle accidents happening because of these kind of interventions. As you know here, for the individual skills, unless you are skilled enough to get the certification from the right authorities that you can drive safely, you are not entitled to use the road and to ride a vehicle. Okay, and even that, one of the important conditions for you to ride is to use a seat belt, because you are going to avert so many problems, particularly for the surgeons in the hospitals, in order to bring your pieces together. If it happened that you have not put your seat belt and you have undergone a serious car accident. So only this seat belt can prevent hours and hours in the operation room, and putting the surgeons in a very high kind of demanding operations to bring you to life again. Like the regulations of getting a speed limit, particularly in some places. So not only the speed limit that could be detected by cameras, and also by putting fines, by how the roads are designed, by getting in the road, you can find it in some places. There are humps that will force you to slow down, so that particularly if you are coming close to school or to a place where the people will cross the road, you have to slow down so that nobody is getting hurt. And also here I can tell about if using the epidemiology, if the traffic authorities have analyzed the places where the car accidents are happening, they can end up with how to improve the chances for the people to stay safe, or to decrease the chances for the for the accidents to happen. Like, for example, if the people are while they are using the roads, there are signs that are taking their attention away from the road, these signs can contribute to having the accidents. Then something needs to be done with these signs and with its location. And this is why we see most of the signs are placed in the stops, the intersections where there is traffic lights. Another example is the tobacco. As you can see here, there is issue with increasing the price and taxes for those who are doing smoking. And the people, if they have not started, please do not start it. If you are already in, there is a risk for you that you can end up in the hospital, or you're not going to live a healthy life. You cannot enjoy your life. And there are groups that can help advocate and the environmental, because if you are in a public place or public transportation, it is not your right to contaminate the place by your smoking. So smoking has all designated places in the airports, but also in the outdoors in some places, not even in the entries of the big buildings, because the air will bring the smoke inside, so that you have to go to another place. So there is a kind of social pressure and economic pressure on those who smoke so that they can quit. And some countries have really done good for this. I'm approaching the end of the presentation. So again, I want to emphasize on the need to use the epidemiology as a science and to use the triad of the epidemiology and the careful analysis of why a problem happens, then assigning roles, defining what could be done in terms of policy, regulations, and laws, and what are the elements related to the environment that the people can have changed for the sake of the positive health outcome, and also what are the services that are made to be in place. Now we live in a world where there is one health approach, so it's not enough for us to do for our own, but we need also to do for the environment, as has been written in some of the scientific journals. Because of the lockdown and the decreased human mobility, the environment started to breathe again. So that has been a kind of bringing our attention to the damage, to the extent of damage that we are causing to the environment around us. So yeah.
Dr. Mohammed Nour, I'm so sorry to interrupt you. You're definitely enjoying the session, but I'd just like to note that for the sake of time, you can have like one more minute.
We are, and yes, yes,
All right,
we
perfect.
are approaching our end. So this is just a kind of simplified concept around health promotion for communicable diseases, because the examples and applications that we have had were about non-communicable diseases. This is about communicable diseases. We know that the healthy diet and nutrition and getting vaccinated to boost the immunity and the education and the economic empowerment and also having the treatment accessible to people who contract the infection are all contribute to containing whatever infectious disease and decreasing the mortality and the morbidity. And I will leave you with these successes for the health promotion application over the last 4 decades since the adoption of the health promotion after Al-Ma'ata and also after the Ottawa Charter. I'm happy to take any questions from your side.
Thank you so much, Dr. Mohammed Nour. Everyone, if you have a question at any given moment, please type it in the chat. We'll be moving to the second part of our session today, to the case presentation, and we'd love to hear your input on that, Mohammed Nour, and all the other community health specialists we have today with us. So I'm just going to share my screen right now.
Yeah, please.
Ahmed Khalid, can you hear us? Ahmed?
Can you hear me?
Yes, we can hear you.
Okay, sure, we can start.
The floor is yours.
Okay, assalamu alaikum. Hello, everyone. In today's case, we have a 35-year-old woman presented to a clinic with headache and fatigue. A malaria test was then ordered. After getting a negative result, she still insisted on taking the treatment for malaria and felt better after taking it. A similar problem happened to a medical student in your class. You talk to your classmate and they say they understand the test is negative, but taking the treatment made them feel better. And that woman was right to do the same, saying even if they weren't sick, prevention is better than cure. So basically, the woman felt the symptoms of malaria. So she went to the doctor and she took a test, but the results came negative that she didn't have malaria. However, she still took the drugs and she felt better. And one of your colleagues said they went through the same situation. And eventually, they said that prevention is better than cure. So they believe that what they did was right. So we have 2 questions. Our first question is, what problem do you think led to this situation? You can ask to answer in the chat or raise your hand or you. Did anybody raise their hands or? So,
Not
yeah,
yet, but
sure. We have someone
we
here.
have. Okay, go ahead.
Yeah, just a second.
I think إنه هي قلة وعيها بالنسبة للأولى بخطورة إنه تاخذ دراج. الحاجة الثانية إنه ممكن تكون ما واثقة بالمكان اللي عملت فيه التست نفسه. ممكن تكون سبب برضه.
Thank you so much, Razan. Okay, you said we have someone also, or did I read from the chat? Okay.
Yes, go ahead and read the answers in the chat.
Okay, so we have an answer. Someone said easy access to medication. So the patient decided what to take. So that's the problem, that pharmacies just give out some medications to patients without prescriptions. So I think that's a very good thing to take notice to. Okay, another answer says maybe they don't trust the lab results, the false negative. The same thing that Razan said, that maybe the patients develop some kind of relationship with the health workers that they don't really trust what the results that they give, and maybe they just decide to take actions on their own. Yeah, another answer also from Mr. Rishma Javid said, lack of trust in healthcare providers, which is, to be honest, an issue that we have here, especially in Sudan, because of perhaps the lack of interest that some of the healthcare providers show in giving the treatments. So this might lead to lack of trust. Okay, we have a hand up. Sure. Who is it?
Yes, we have a hand up from Ahmed Khalid. So please go ahead and unmute yourself.
أنا فرح. I'm using Ahmed Khalid's phone.
Oh, okay. Welcome, Farah. Please go ahead.
So Iman said that miliarity وبعرفها, and she said that she was joking. But I think this is kind of true. Like في حتات زي مدينة مثلا الملاريا فيها بتكون already endemic، أكيد بتكون جاتها أكثر من مرة. فشيء طبيعي انها تكون مثلا قبل كده يعني حست باعراض اللي هي السيمبتومز بتاعت الملاريا، الفيفر، معها رايجرز، معها هيدك. فلما تجيها ثاني اكيد هي اول حاجه حتحطها في راسها انه this is a similar problem، فحيكون نفس الدايجنوزس. دي النقطه الاولى. النقطه الثانيه انه ما طوالي التست ريزولتس بتكون accurate، بالذات في المراكز الصحيه اللي بتكون في المناطق الطرفيه وكده، ففي احتماليه كبيره شديد للفولس نيجاتيف ريزولتس. ف يعني لما مثلا تحس بنفس الاعراض وتمشي تفحص تلقى انه النتيجه نيجاتيف، ف احتماليه it's kind of reasonable for her انها to take the medications بتاعت ال disease that she thinks that she's having right now. And thank you.
Okay, thank you so much, Farah. I have a very quick question for you. If you think that the patient decided, or based on their information, they decided that the results weren't accurate, and perhaps there is a false negative or something like that, what would you suggest that the patient should do in this case?
Well, I would suggest that she go to another healthcare center and repeat the test. She can repeat it like many times till she gets accurate result. If it's negative, maybe it's other problem. But in this situation, if it's not available for her to go to other health center, I think she can take the drug. This is so controversial, but I feel like this is the right thing to do.
Okay, thank you so much, Farah. We get your point. Okay, we're going back to reading answers from the chat. So someone said malaria is endemic, this recurrent episode, and even with taking medications, recurrence may occur, which is kind of similar to the same thing that Farah said, that in endemic diseases or diseases that are very common and recurrency is known in them, patients tend to just take their own decision and just diagnose themselves and take the medications. Okay, so do we have any other answer or someone who wants to say anything? Okay,
Yes, Ahmed,
here.
Lujen, who said that answer, before that someone, Lujen, who said that answer, has her hand up, so she could come up and clarify too. Lujen, if you could unmute your mic.
Okay, sure.
أيوة أنا عندي وجهة نظر إنه مثلا الناس في السودان عموما أي أعراض تجيهم يعني بيثبتوها على الملاريا فبياخد دواء ملاريا مع التغذية الكويسة مع الراحة مع الأعراض بتبدأ تخف يعني فممكن تكون دي الحاجة اللي بينسبوها إلى علاج الملاريا.
Okay, thank you so much, Jane. Yeah, this is very common in Sudan, especially with malaria, which is like the commonest disease here. Okay, so Fatima, she wants to say something.
The audio isn't good over here, Ahmed. We can't hear.
In addition to that, he don't trust the health center test and he had the symptoms before that. In addition to that, her neighbors that have a poor education, she tell her that we take the medication and we take and she take the malaria medication because they felt the symptoms that is similar to her symptoms. She followed them because he had a poor education too.
Okay, thank you so much, Fatima. Basically, she said that perhaps she took the advice of a neighbor or someone who had a similar situation and they took the drugs just by diagnosing themselves, which is also super common here. People tend to just take advices from their family members, from their neighbors, whoever, classmates, just saying that I had a similar situation and I took the drugs immediately. This is what everybody does now. We don't have to, just counsel with anybody. So we don't. Okay, we have one more participation. Sure. Just a second.
طيب مرات بيكون في اوفر دايجنوستيك للملاريا على حسب الكلينيكال سيمبتومز بس بالذات في الرورال ارياز لما يكون مثلا ما في يعني يكون في بور دايجنوستيك فاسيلتيز فبيقوموا بياخذوا بالكلينيكال سيمبتومز بتاعت البيشنتس دي وعلى اساسها بيشخصون بالملاريا البيشنتس بيحفظوا انه خلاص السيمبتوم دي كل ما تجيني معناها دي الملاريا بس احيانا في ناس يعني يتجاوز الطبيب فبيقولوا يمشوا للفارماسيست مثلا فبيقولوا اعراضه فاز رونج براكتس من الفارماسيست نفسه فبيقول هو بيشخصهم از ملاريا وكده فالتست اللابريتوري تيست بتاع الملاريا ضروري شيء الانفورميشن بتاع الكيس فبعض الناس يعني get over information فبشخص على حسب الكلينيكال سيمبتومز فبيثبت للناس نفسهم البيشنتس والناس عامة انه هو بس الدياجنوستس بتاع الملاريا فبيتند انهم يمشوا ياخذوا العلاج غير
Okay, thank you so much. As she said, that it's become a common practice here for patients to just basically diagnose themselves from the clinical symptoms or bypass the doctors and go directly to the pharmacist. And pharmacists have come used to making a wrong practice, which is just giving the medications without any confirmational diagnosis from the laboratory test. Okay, right now we're going to go to the second question. Changing a patient's mind or convincing them. Okay, we have a hand up before going to the second. We are going to have for the first question or for the second question from Tajasir?
From the first question, من البداية.
Okay, so changing a patient's mind or convincing them to follow a doctor's advice can be difficult. What health promotion strategies can be used to get patients to listen if they refuse? Okay, go ahead, يا Tajasir.
لا أنا كان تعليقي في السؤال الأول أقول برضو
يا ما مشكلة.
أوكي عشان الكيس دي كان حصل لي شخصيا 100%. كان هو جاتني الأعراض ومشيت فحصت وجات نيجاتيف. ففي الحالة دي كان بس رجعت أصلا الأدوية قاعدة معي، فبس سألت دكاترة معنا في البيت، أخذت رأي دكتورين ثلاثة قال لي أبلع الأدوية وجيت بلعتها وتحسنت. فكانت تصرفت أنا كده في الوقت ذاك.
Okay, I think sometimes it might even be just a common situation here to have these kind of practices. Perhaps the poor skills or equipments that some of the health workers have or their lack of attention can lead to patients just taking steps on their own and then doing this repetitively until they have enough confidence to even share this information, and it becoming very common here. So we actually have someone who had a similar situation, and I'm pretty sure everybody here, especially if you live in Sudan, I've had yourself or a person you know had a similar situation in which they just took drugs on their own. So yeah, it's very common. Thank you, Tajasir. So do we have any answer for the second question?
If I may jump in here, Ahmed, and I'm really sorry to put you on the spot, Dr. Fawatih, but could you offer us some insight on this problem here, if you can hear us?
Yes, I can hear you.
Okay, please go ahead.
First of all, if somebody could remove the other Fawatih, because I joined twice. Now I have echo when I speak.
Oh, okay, let me, one moment. Okay, could you try now?
Okay, so yes, I think you removed one of me.
Yes, yes, I did.
Good. So before answering the question or give an insight here, I just want to say that I'm very grateful to be here with you all. This is my first session with you in the Sudan ECHO program, and I'm very happy to have this program being implemented with University of Jazeera. I'm a graduate of Jazeera University myself. I am batch 14 and very proud of all the work being done here. I work now as an assistant professor of public health at the University of Connecticut in the United States, and I teach public health administration. At the same time, I work as a community health epidemiologist at Yale New Haven Health System. And I had a lot of experience working in rural areas in Sudan before leaving the country. So I hear all of you, and I concur with many of you here that sometimes we treat people on a symptomatic basis. We in cases we miss the evidence from the lab test. But however, something we need to consider is that this behavior, whether from patients or public health or healthcare practitioners like doctors and whoever is prescribing medicine, this behavior could mask other febrile illnesses. And we know that in Sudan, it's an endemic of malaria as well as other tropical diseases. So in your practice, especially for medical students, in your future practice, you will treat many patients with malaria, whether they have a positive or a negative lab test, but you will miss some cases of other illnesses. So it should be deferred to the judgment of the physician or the treating medical personnel, because there are many symptoms that you could weigh things and say, yeah, this is most probably a malaria. And you could also, if you are well trained, you could also try to exclude other febrile illnesses in the area. Depends on where you are practicing. Like, for instance, if you are in Al Gadarif region, you will think of leishmaniasis and things like that are also popular. The other thing that is coming from this case is that this patient, the 35-year-old woman, she decided to take the medication, not her physician or her healthcare provider, which is raising an issue of the common practice in a country like Sudan, where people decide by themselves on what they have, what treatment they should, what to do. This is also not a practice that we as healthcare professionals need to encourage. And people talk a lot about health promotion from the perspective of educating people on what are the facts, how they should make decisions and take actions. But sometimes there are things bigger than the individual's ability to take an action. It's the systems in place. And especially here in the US, we talk about social determinants of health and the things outside the health care that lead people illnesses or being unwell. Sometimes, even if you're knowledgeable, there are challenges in front of your way that will obstruct you from taking the right action. So in this situation, the availability of medications everywhere, and I know it was since a long time, and I'm positive it's still the case in Sudan, that you could purchase anti-malarial drugs from a grocery store. That is really a common practice, because I had seen this. And you can buy it from the pharmacy without a prescription. You should just go to the Saydaliya and say, yeah, I want a chloroquine or whatever it is now people are using. So it's this, because there are no strict guidelines on how people prescribe or how people get access to medications. This is a motive to patients and people to act upon themselves and take decisions. So it has to work together. You need to promote health and educate people. At the same time, you also want system in place to safeguard the practice that you are encouraging people to do. So that's my briefly my take here and my insight. Thank you so much.
Thank you so much.
Thank you so much, Dr. Fawateh. And sorry, Ahmed, for those who do not know, as Dr. Fawateh said, she is a graduate of the University of Jazeera. And another little spoiler is that she's going to be presenting a session for us in about, I believe, 4 weeks. So look forward to that. Okay, back to you, Ahmed.
Okay, we're very excited to have her again here, inshallah. Super informative and a very nice perspective to the problem as a whole. So thank you so much, Doctor. I'm going to read some of the answers from the chat now. Okay, I think Lujain or Iman, actually. She said, I think the lack of applications of quality and control strategies in our health facilities to ensure the services lost us our confidentiality. First, I activate these strategies and involve patients in random audits. She also continued with another message. She said, this will make our clients have trust that we are concerned about their complaints, about the results, and do some things to check our lab accuracy. This will make it easier to convince them next time or decrease the level of his doubts at least. So thank you so much for Iman. I think that's a very nice idea to provide that the quality controls and the health facilities and systems, they should need to implement more accurate or more strict policies to ensure that the health services providers are doing their absolute best to get the best results and making sure that they are presenting themselves to the patients in the best way to gain the results. Okay, so
Okay, Ahmed. I think we covered all the answers in the chat. For the sake of time and before we end, for answering, thank you so much, Dr. Fawateh, for giving us insight on the first question. Answering the second question, we'd also like to hear Dr. Abil Tib from the Faculty of Medicine, University of Jazeera. Dr. Abil, if you can please help us or give your insight answering the second question.
Thanks a lot. Thanks a lot, my student and my colleagues, who give me this chance. And I very grateful of my students of presentation and so on and discussion and negotiate these most important concepts in health. It is a health promotion. So before answering and go further in negotiate this case, thanks Dr. Fawateh for saying that about holistic approach and for management of any febrile case or any febrile condition, especially in our country or developing country. Not all febrile, we must put in mind, in our mind, not all febrile condition is the malaria, although it is an endemic. Because before go to lab investigation and so on, we must do a holistic approach in history, in details, and in examination. And so, as WHO recommendation, if we put a differential and one of them it is a malaria, so we must do lab diagnosis to ensure that it is a malaria. So there is a lot of malpractice in a lot of people and citizens in our Sudan and developing country. What our rules? We are a student graduate. Most of them we are graduate from Jazeera University. So we must change this malpractice. I think this is a good opportunity. If we have one message and one yield point from these lectures and this nice discussion, we must change the malpractice that we face in our community and in our families. Thanks a lot for this chance, and I think if we all give this message, we can develop our health pyramid in Sudan. Thank you.
Thank you so much, Dr. Abir, for sharing your opinion and your thoughts with us. I think we're going to take one more answer from Nujen Osama. Your hand is up, Nujen.
يعني أنا يعني هسه حاليا مستقرة في مصر، ففي حاجة في الصيدلية قاعدة أشوفها بتعجبني، إنه مثلا يعني ما في كل الصيدليات، لكن يعني يكون في دكتور موجود في الصيدلية أو في استشارة فاتحة من دكتور في الصيدلية. فالحاجة دي يعني كون إنه الناس اللي ما مقتنعين مثلا يمشوا يقابلوا دكتور ولا كده، فالحاجة دي ممكن تساعد. فبالنسبة لنا إنه إحنا ممكن تكون في السودان صعب إنه نوفر دكتور في الصيدلية ولا كده، فعلى الأقل نعمل توعية لناس الصيدليات، يعني يكونوا على الأقل عارفين كل ما يتعلق بالملاريا إن أند أوت أو الفبرايل إلنس، عشان لو ما قدروا يقنعوا البيشن يمشي يقابل الدكتور، على الأقل هم على حسب الحالة المتوفرة لهم أو الأعراض اللي هم شايفينها وسألوا منها يقدروا يجوا الرزول ده لا والله دي ما ملاريا دي ملاريا أو كده يعني. فلو جينا على الطبقة إنها هي متأكدة تماما إنه دي ملاريا وجاي ياخد العلاج بس من الصيدلة يعني. لكن زي ما قالوا كل دكاترتنا حسي الأهم إنه إحنا نعمل awareness للناس إنه لازم يقابلوا الدكتور، إنه في للدكاترة يكون في فبرايل إلنس تانية مفروض يخطها في الحسبان. فدي حاجة أنا فكرت فيها ويعني ما أعرف فشايف إنه دي ممكن تكون من الحلول يعني.
Okay. We have 2 questions here before we can proceed. So just a second.
My question is
sorry, we can't, the audio isn't, could you repeat again? Sorry.
وأنا ما عندي question لكن في كومنت في السؤال الثاني يعني حاجة إحنا ممكن نعملها. فمثلا أنت قلت المشكلة اللي بتواجهنا إنه البيشنت بيمشي براو للفارماسيست يقول له أنا عايزة الدور بتاع الملاريا لأن أنا شاكة عندي الملاريا. فهل ممكن إحنا نعمل بوليسيز تمنع من إنه يصرف علاج الملاريا من دون بريسكريبشن يعني يمنع أي بيشنت ياخذ العلاج بتاع الملاريا لو ما كان في بريسكريبشن من الطبيب أو من مساعد طبي أو من زول يعني عنده صلاحية لأنه يصرف الدواء ده. فكده إحنا بنخفف من استعمال الادويه ساعات في نفس الوقت بنقلل من انه الادويه بقت بتحصل لها ريزيستنس فدي بتحطنا في البروبلم تاني احنا كل مره اسمه موجود ريزيستنس للملاريا تبقى لو ريزيستنس فدي بتبقى لنا مشكله احنا احتمال ما نقدر ثاني ذات علاج الملاريا اللي احنا بالنسبه لنا اندمج وعاديه بس
أنا I would like to 100% agree مع كلامك. هي فعلا البوليسيز ممكن تساعد شديد في الحكاية دي لأنه أسف في بلدان تانية الواحد حتى الأموكسيسيلين اللي هو واحد من أصغر الأنتيبيوتكس الواحد ما بيقدر ياخده من الصيدلية بدون بريسكريبشن عشان الناس توقف الموضوع بتاع الأنتي مايكروبيال ريزيستنس. بس برضه في مشكلة بسيطة في السودان في الحتة دي في إنه الناس في السودان في واحد فيهم ممكن يقول لك إنه يا أخي طيب أنا إذا ما بقدر أمشي أخذ الدواء من الصيدلية عادي لا يعني الحكاية تبقى عند الناس اللو سوشيو ايكونوميك ستاتس إنه بيقول لك انا ما عندي قروش كفايه انه امشي للطبيب عشان يكتب لي الوصفه وامشي للصيدليه عشان اشتري الا اعمل واحده فيه. فدي واحده من الحاجات اللي احنا بنضطر نخدها في بالنا في الحتات زي دي. بس الحكايه بتاعت انه البوليسيز تو ستوب الانتي مايكروبيال ريزيستنس دي مهمه شديد ومفروض احنا نعملها في السودان يعني. شكرا شديد.
Okay, thank you so much for your question and thank you, Dr. Mustafa, for your answer. We have another question here, just a second.
Comment no questions and the second question. Not a question. We must combine the patient. Not all our beliefs about our health is true. Most our health problem must be compared scientifically and not lead our psychological illusion to control us about the health mechanism.
Okay, thank you so much, Fatima, for your comment. I 100% agree. I think that people should depend more on scientific based decisions and evidence, not just taking decisions based on their experiences or their emotional state. Okay, so Fatima.
Yeah, and before we go back to Tima, if I may, بس زي تذكيرات بسيطة كده بما إنه نحن خلاص مش عارف نوصل لنهاية السيشن. نحن آخر مرة كان رسلنا زي pre-assessment survey للناس كلها. السيرفي ده بيساعدنا إنه oh sorry I see إنه كمال حسن رافع يده. كمال, would you like to say something? If you would like to answer, please unmute the microphone or go ahead.
Hello, all of you. Thank you for this nice presentation. What I want to say is that it is difficult to convince Sudanese people it is difficult to convince them that not all febrile illnesses is due to malaria. They think that the only reason for febrile illness is malaria. It is very difficult to convince them about that is not true. The other message is that we need to use all kinds of mass media to raise our people awareness of the importance of that. These febrile illnesses could be due to other causes. We need to make constriction on the prescribed drugs by the pharmacist. We have to control this. in order to prevent the occurrence of resistance of this anti-malarial and antibiotics, we have to constrict our prescription. We need also to raise people awareness of stopping taking medical advice from other people than doctors. As we know all, a lot of people giving medical advice and they are not specialized, and this which is not true. So we need to use the media for raising people awareness of importance of all of this. Thank you for this nice presentation.
Thank you so much, Kamal. And that is 100% true. We do need to raise the awareness of our community. And that is one of the reasons why this program was created, to try to achieve a more health educated community and a more healthier community. Because when people are not very well health educated, they sometimes resist believing what doctors say. Like you said, people sometimes won't believe if we told them that malaria is not the only cause of febrile illness. So raising awareness is a very important step in solving that problem. Going back to the small reminders. Okay, go ahead.
If I can just jump in, Michelle, before going to the reminders. So if anything, guys, thank you so much for attending today. I think that we now know the problem. We identified the root cause of the problem, and we discussed everything that might be a cause of it. Now, and we know how to fix it. So please keep in mind, and if there's anything you should take away from today's session, is that when you go into your families, when you sit with them, whether be it the family visits that you go in biweekly or the rural visits, keep in mind that do not forget about the session. Sit with them, let them know that what malaria is, the causes, the preventive measures, the right preventive measures, and make sure that your family understands not to just go to the pharmacy and get any drug over the counter without a prescription, especially if it's a malaria treatment. So if anything, if you just take away these two messages, I think that would be great from today's session.
Okay, thank you so much. Yeah, I believe we have some hands up in the hall. Please go ahead.
Yes, I see Ahmed Khalid's hand. I believe that's Farah. His hand is up, and we have a hand raised from the hall. So Farah, you can go.
Regarding this problem, I have a friend who studies medical laboratory science. I told him about this problem, and he told me that the techniques of performing the test could be also affecting the results. فأنا شايف إنه مثلا يكون في دورات توعوية ل students who study lab technology بحيث إنهم يكونوا قادرين إنه حتى with poor facilities إنهم يعملوا الفحص بطريقة كويسة. يعني مثلا الفحص بتاع البلود فيلم فور مالاريا انه هو داير تكنيكس كويسه يعني. فحتى لو زول كان ما متاح له غير الفحص ده، يعني مثلا اي سي تي فور مالاريا از نوت افيلبل، فلو عمل التست المتاح بطريقه كويسه ممكن يضمن الاكيوريت ريزولتس. فانا شايف انه نعمل حتى في البروجرام بتاعنا برضه نشوف الناس اللي بيدرسوا مختبرات في كليه مختبرات جامعه الجزيره ذاتهم، بحيث انهم يكونوا داخلين برضو في الموضوع معانا. And thank you.
Thank you so much, Farah, for suggesting that. Inshallah, for the upcoming sessions, هيكون عندنا a multidisciplinary approach وهنقدر نسمع من الناس مختبرات ذاتهم. So thank you. That's actually a really important point. We have a hand مرفوعة في القاعة كانت في الهب. Is it still raised? Oh yeah, I see it's still raised. ما تفضلي.
I think إنه حتى البيشنت نفسه الحاجة دي عامل نفسي في البداية. إنهم افتكروا من العادات الموجودة عندنا إنه والله أول ما أحس إنه عندي مثلا فيبر خلاص أنا عندي ملاريا، أول ما أحس إنه تعبان أنا عندي ملاريا، فبقت عندنا دي بقت زي العادات كده. وفي نفس الوقت إحنا ممكن نلعب على الجانب ده ونوعيه إنه والله الدرجة اللي أنت بتاخذها في النهاية هي سموم، فأنت لما تاخذها بعد شوية هيحصل لك ريزيستنس للموضوع ده. ثاني فيما بعد أنت ما حيكون عندك أصلاً طريقة إنك تاخذ علاج، هتبقى بعد شوية زول مرضان لكن ما عندك علاج. فممكن نلعب على الجهه دي، وفي نفس الوقت يعني خلاص حيكون كون عنده فكرين والله انا لو اخذتها وانا اصلا ما متاكد شو انه الحاجه دي عندي، هيبقى عندي مشكله، بعد شويه حتبقى مشكله اكبر، بعد شويه حمرض بحياتي عليها. فكر.
بالضبط كده. Thank you so much. يعني ده واحدة من أحسن الطرق that we can actually tackle a placebo effect. So thank you for sharing that. I don't think we have any hands raised. Mujtaba, back to you.
Yes, thank you so much. زي ما كنت بقول قبل انه نحن عندنا زي بري اسسمنت سيرفي كده كان رسلناه في الايميل للناس كلها المره اللي فاتت، هو بس عشان نعرف to better الكواليتي حقت السيشنز، وبرضه it is a requirement للمونيتورنج and evaluation of our program. إضافة لكده الريكوردينجز برضه شكرا لكم كثير إنه انضميتوا لنا الليلة and we hope to see you again في السيشنز الجاية. الريكوردينج حق السيشن طبعا ريكوردد، حتترسل لكم في هي حتكون يوتيوب لينك، حتترسل لكم في الإيميل في خلال الأسبوع الجاي إن شاء الله أول ما نرفعها. إضافة لكده للناس اللي joining from their homes، إذا عندكم أي مشاكل في النت أو حاسين إنه you would like to join في القاعة من جامعة الجزيرة، you are very welcome to. القاعة بتنفتح للناس كلها الممكن who want to join. وآخر حاجة بس عايز أقول لكم يعني السيشن الجاية حقتنا بعد أسبوعين إن شاء الله حتكون مع Mr. Jeffrey Weatherhold from Ohio Advisors. هيجي يتكلم معانا عن ال quality improvement and how quality improvement can be implemented into health والuses حقته. And over again to you يا فاطمة.
Thank you so much, Mujtaba. بس قبل ما نختم نشوف any last words from the owner of the project, Amal Hassan. Dr. Amal, do you have anything you'd like to say?
شكرا لكم كثير، وشكرا دكتور محمد نور. نشوفكم بعد أسبوعين إن شاء الله يوم السبت يوم 22 في السيشن الجاي إن شاء الله. شكرا لكم.
Thank you so much everyone for being here. See you in 2 weeks. Bye.